Hello, and welcome to our webinar series on the 8 professional competencies for preventing drug misuse among college students. I'm Rich Lucy, Senior Prevention Program Manager in the Drug Enforcement Administration's Community Outreach and Prevention Support Section. DEA is pleased to be part of this project to highlight the skills necessary for coordinating comprehensive campus efforts to prevent drug use. While we have made significant progress with these issues over recent decades, much more remains to be done. The foundation for this webinar series is a publication prepared by Dr. David Anderson, Professor Emeritus of Education and Human Development at George Mason University. The document was produced with funding from the Mid-America Prevention Technology Transfer Center, which is funded by the Substance Abuse and Mental Health Services Administration. DEA is pleased to continue its partnership and collaboration with SAMHSA and its Center for Substance Abuse Prevention. Over the course of these 8 webinars, we take a deeper dive into each of the core competencies that are designed to promote enhanced professional skills and ultimately affect college students' decisions surrounding drugs and alcohol. This 6th episode focuses on policy and environmental strategies. This webinar emphasizes, among other things, the importance of a systems approach to policy development, implementation and review, consistency in enforcing the campus's policy, and communicating the policy to all students, faculty, and staff. Campus policies not only complement local, state, and federal laws and ordinances by attending to campus-specific issues, but also encompass the overall goal of the campus's prevention effort for shaping a safe and healthy campus and community environment. That health-enhancing environment illustrated in the graphic I just shared. It's our hope you and your campus benefit from the information being shared in this webinar. We think you'll find many ways to put the insights and contents to good use. With that, it's my pleasure to turn over today's episode to our host, Dr. David Anderson.
Thank you so much, Rich, for that kind introduction, and thank you to you and your colleagues at the Drug Enforcement Administration for your support of this webinar series. I appreciate all that you've been doing over the years to deal with drug misuse prevention for our nation and for our college campuses. So thank you, and again, thank you for hosting this webinar series. You know, we've done a lot over the years, over the decades, to deal with campus drug and alcohol issues. We've made a lot of progress, and we have a long ways to go. And that's where this resource, the guide to the 8 professional competencies for higher education substance misuse prevention, that's where this resource comes in. And that's what we tried to do as we developed it. Our aim was to enhance the knowledge, the skills, and the applications of our college professionals and their colleagues on campus and surrounding the campus to address this with our college students. This resource is available at www.preventioncompetencies.org, as well as on your website. And to help build and create this resource and the other resources within this resource, which we'll talk about today, I convened 5 experts from around the country. People with great experience and different perspectives on and different skills on addressing this issue. And we have 2 of them here today on this topic, our 6th of the competencies series, Policy and Environmental Strategies. We have Dr. Jim Lang, who is coordinator of AOD initiatives at San Diego State University and director of the Higher Education Center for Alcohol and Drug Misuse, Prevention, and Recovery at The Ohio State University. Those are long titles. Then we have also Joan Masters, who is the project director of Missouri Partners in Prevention. Less of a mouthful. Welcome to both of you. Glad that you're both here.
Thanks
So, Joan, just for each of you, a little bit of background. Joan, I'll start with you. Just a little background about your background, your experience, particularly as it relates to policy and environmental strategies, you know, one of our 8 constructs.
Sure. So in Missouri Partners in Prevention, which is our coalition of 24 colleges and universities in the state of Missouri, we know that change does not occur without an emphasis on both individual strategies and environmental strategies. And often environmental strategies do involve policy work, and not just having a policy, but adjudicating it, providing support for those who have violated the policy, and making sure that that policy is appropriate. So a lot of the training and technical assistance, the speakers that we bring in, the consultation we give to our coalitions that we work with involves how to do that work, because it can be very complex for folks that maybe don't have a policy or a public policy background.
Okay, very helpful. So really boots on the ground experience from a statewide coalition perspective. Yeah, that's very helpful. Jim, just a little background about linking to policy and environmental.
Sure thing. So I've been working at San Diego State University around the prevention programs for over 20 years. But before that, I was doing mostly research around the issue of both policies and the impact it has on consumption and the harms associated with it. And so it basically looking at how the community can either be set up in a way that it can promote a healthy approach to alcohol and other drugs, or facilitates things that are quite harmful. So looking at it, studying it, gathering data within the communities so that we really better understand that environment and how it impacts our students.
Very good, very good. So we have some questions I'm going to have each of you comment on then. Jim, I'll ask you the first question, and then Joan may react and have some other perspectives. But you know what Rich pointed out, and all of us know that when we created this resource, this guide, and these competencies, we organized it around a health enhancing environment. And we said, here are 8 competency areas in that health enhancing environment. Can you talk, Jim, a little bit about the policy and environmental piece and how that feeds into a health enhancing environment for the campus?
Yeah, sure thing. I mean, it's really helpful for the campus professional who's working on this to look beyond the individual, look beyond maybe even the campus, because much of the behavior and much of the decisions is happening in the community. And when you start recognizing that, and there's a model often called the socio-ecological model, and it demonstrates that there's various layers that impact the decision and behaviors of individuals. So if we're just focusing on the individual, understanding what they know and their attitudes is really important. But once you've got that, then you start going into the next levels, like the interpersonal, their friends, their groups that they're going to be engaging in some of these behaviors with. And that has influence that's beyond their individual attitudes, knowledge. And then within that, there's even other layers. So the institution itself, your campus, your university, there's policies, there's access, there's issues around all of these things and enforcement. Those will impact both the friend group and the individual. And then within the community as well. Sometimes I'll say things like, most of the alcohol that students are drinking, they didn't brew themselves, nor did the campus. It's really a community-wide, and it goes all the way to society, and there's policies that impact each of these layers. And so the campus professional needs to understand that so that they can champion work that goes beyond individual level, because at the end of the day, a lot of the influence comes from the structures and the relationships that happen within the community.
So just to reinterpret that and correct me if this is not correct, while we ultimately care about the behavior of the individual student, that behavior is influenced by these other layers. As identified in the model. There's a lot of different, that translates to the campus decision makers, a lot of different touch points to try to affect those policies, that environment, norms, trying to affect that, because those ultimately affect the individual behavior. Is that a fair summary?
Yeah, absolutely. I mean, when you start thinking about what are the behaviors available to the individual, a lot of it comes from what's available in the community. What are the things that they even would consider looking for? That comes from knowledge of what the community has available. So these ideas of access, availability, they influence the decision making, because that's all input into what should we do next. You don't come up with things that are impossible. You come up with things that are available and accessible, and that's where it goes down to the individual, but you can have impact into the broader community.
Yeah, of what's available and accessible, because if they're not available or accessible, they're just, it's not there. Joan, some thoughts on that same question?
I think it's really important for what's reflected in these competencies is for campuses or a campus prevention professional to stay ahead and to know how public policy affects the work that we do, and how it will affect it, just like Jim said, how it will affect the choices, the individual behavior, the knowledge and attitudes that our students have. So I see that in a lot of the drug policy that is made by individual states, and how that drug policy or that alcohol policy has little to do with the campus. It's made on a statewide level, but it has profound impact in communities, or college communities particularly, and how that sort of acts, how students know about those laws and policies. Maybe they're coming from another state and have limited information. And so I think that what these competencies challenge us to do is to stay ahead of the public policy work that's being done, maybe not engaging in advocacy or lobbying that would be inappropriate for our roles, but to be informed consumers of what's coming out and then anticipate correctly, because Jim reflected it perfectly. There's things outside of a collegiate environment that are going to affect the way our collegians matriculate through the academy. They have little to do with what the structure that we set up.
So staying ahead and being up to date, if you will, on the state and national policies, and then informing others, informing students, informing the intermediaries on our campus, whether it's staff or faculty or administration. Is that a fair thing?
Absolutely.
Yeah, and then I know you said, I think something about advocacy. So sometimes there's opportunities that are appropriate where we can help inform the policy that is being made. Advocating for services, advocating, this could be at the local level, at the state level, the national level, advocating for some guidance, some direction, some support, some understanding. So that, and I know that's another one of our modules on communication and advocacy. Mm-hmm. So shifting, unless you have something more to say on this one, Jim, I'd like to shift to another question. You okay? Okay, well, let's shift. Joan, in this competency area, this area of policy and environmental strategies, we have 7 distinct clusters, 7 different competencies within there. So the question is, which is most important, or which 2? I know, not which 7. I know, right. We know, we all as a group of 6 of us develop these, but what jumps out, what's most passionate, what's most important for you? And what do you think is most important for your campuses that you work with?
I think what is both most important and potentially even most impactful for the campus is the first competency related to promoting policy context, and then the 5th competency related to overseeing enforcement, and then the application. So I'm going to talk a little bit about how both of those, I think I see that reflected in some of the work that our campuses do. And first of all, I think that I hear from preventionists a lot that they got into prevention to do education and to work with people individually. If they wanted to be a politician or a lawyer, they would have gone to law school. And so the importance, though, it goes back to exactly what we talked about on that last question, is that policies, and then the sort of the three-legged stool of policy work, the education, the adjudication, and the enforcement, and then obviously the support that we give to the student that might have broken that policy on campus, is an extremely important part of prevention. We know that for young people, or really for honestly all people, but given a college student's adolescent brain, that if they believe that something, they might have a consequence of doing something, they're less likely to do it overall. And so if policies are enforced, if there are strong policies, if those policies include an adjudication that is an evidence-based adjudication that is will help the student make safer choices, that's a place that policy has in prevention. So I think we have to note that policy has an absolute place in prevention, and if we fail to recognize that, we're really only doing half of our jobs. The last thing that I want to talk about is the second piece that comes up in overseeing enforcement and monitoring results, and that is making sure that our policies are not overreaching or hurting particular minoritized populations or populations that are underserved and don't have the resources to necessarily make choices related to having a health promoting environment. They don't have maybe have more mental health disparities or something that might make it more challenging. So I think it's important for us as we do our policy work to consistently think about how a policy is enforced, how a policy is adjudicated and held responsible on a campus, and also how it might be affecting certain subpopulations. And I think that then brings in our cultural humility piece of constantly monitoring before we put a policy in place, when we put a policy in place, and as we see that policy through. Is this hurting a particular group or harming a particular group? Is it targeting a particular group? But what we want to see, if we're truly moving forward as a competent prevention professional, is that we're not only just noting that policy is important, but we're also noting that policy sometimes can have unintended harmful effects, especially for those that we want to support the most.
So it's thinking about enforcement on the front end, but also monitoring what is happening once you implement the policy. Is it having the intended effect and avoiding the unintended and or negative effect? Is that which is, yeah.
Absolutely.
Jim, some thoughts on that same question?
Yeah, well, I think what Joan was saying is spot on. So I'll throw a curve that maybe is a little less thought of, is that within that concept of checking for unintended consequences, seeing how it's working along, implies that you're measuring. And so having the evaluation and measurement as part of the policy, as part of if there's changes going on, or if you're trying to understand possible lack of reach. So for instance, on a college campus, there's often student organizations, some of which have different policies layered upon them than other student organizations. And so there's a different sort of enforcement, a different type of expectations around how they might throw a party, for instance. And then that may leave other types of organizations kind of free and clear, not part of the policy, so that maybe it's not a universal set of protections that are happening. So starting to measure how parties are being thrown, what sort of elements of policy need to be in place to make it a less risky environment, it will come from measurement and evaluating how these things are applied to various groups. So I'll just throw in that other competency of a measurement and evaluation and that assessment piece, does intersect with the policy and community types of programming.
Yeah, and you know very well the expert who speaks to that in this series, and very eloquently and even more detailed than what you've just said here. So again, and I think what you're highlighting then overall is, you know, the intersection of all of these, each feeding into the other. We've talked about some of these, you know, already, but just reinforcing that. Next question is looking at some other examples of policy that might be envisioned, or, if you will, environmental strategies that you envision and then you bring to fruition. Again, you know, Joan, you talked about as you're thinking about this, you know, think about the enforcement part on the front end, but how about environmental strategies and some examples that you know over time, whether it's with a campus or a statewide coalition? Just bringing this more to life. And again, it can be any of these 7 areas or the cluster as a whole. Some examples would be helpful. And then Jim, I'll ask you the same thing.
I think that there are 2 things that come to mind. One is I often hear from campuses that will say things like, well, our prevention isn't working because our education isn't working. And I think they fail to recognize, again, that one individualized education or one-on-one education is only as good as the environment which supports the concepts that you're talking about in education. So it goes back to that socioecological framework that Jim was talking about, and that I can be a tremendous health educator and give tremendous skills and increase knowledge among students. But then when they walk out into a community where maybe drinks are free for everyone of a certain gender, maybe there is certain price promotions, maybe everyone just knows where you can go and drink underage and no IDs are checked. Those are all opportunities in which policy could have reinforced the great skills and attitudes and opportunities that I might have talked about in my presentation, and it didn't. So to give that a campus example, there was a campus we've been working with for many years who had some concerns about underage drinking, especially underage drinking and driving. And it came to really light that a portion of why so many students were going into the community and drinking and driving home, but also engaging in drinking behavior, even though they were under the legal age of 21, was because they had an age 18 entry in bars, even though they weren't supposed to be served, they were. And so there were many things from a policy perspective that could have been done in the community, like responsible beverage service training, ID checking, putting, you know, they did successfully raise the bar entry age for not restaurants but bars to 21. Those were all things that created a more protective, a health protective environment in this area. But that was only as good as that. Those were just policies. Those were practices that were put into place. At the same time, they needed to have wraparound education and harm reduction services. So thinking about, again, how students, even if they weren't drinking, they were drinking with others, how they were getting home safely to the campus. The idea of safe ride programming or safe walk, well-lit walkways, things like that. The rise of Uber and Lyft in this community that wasn't there before, things like that. But at the same time, then the campus had a responsibility to educate students about that bar entry change, about the fact that if they tried to use a fake ID, it was going to get confiscated from them because these new things had happened in the community. So it really goes back to, in this case, I kind of walked the socioecological model backwards, where there was a policy change in the community that was meant to really change student behavior. But there was something that needed to be done at all aspects of the socioecological framework. And it also thought about what are the unintended consequences of this policy, how might students get home if they came to the bar area and were turned away? What if they didn't have a ride anymore? It was really thinking through, and that's really what we I think what this section of competencies asks a prevention professional to do is to think about how students are educated about safe decisions through policy and not just through the education that we provide, and how policies can reinforce the skills and attitudes that we talk about with them in our individual strategies that we do.
Yeah, and one thing to highlight out of what you've just said, some of that example was an off-campus venue. So that's officially not within the campus purview. I mean, it's where the campus can influence with good community relations. So it's just to clarify, I mean, there's policy environment that you can do within the campus boundaries per se, the legislated or whatever you own. But then there's also the relationship with the community, with the bars, the restaurants, and so forth. And so it's not to negate that, because that's very much of the students' experience of their environment. Is that fair?
Absolutely. And I think one thing that often I hear from folks who work in the community is, well, if we stop them from doing it here, it's just going to pop up somewhere else. And I absolutely believe that prevention is like a game of whack-a-mole sometimes.
Right.
But that doesn't mean that we shouldn't. Again, the competencies ask us to stay ahead in public policy and require us to really think about, again, what those consequences will be. So if we change the way in which students are able to access alcohol underage in that community, it could have, if the campus was not on top of it, led to an increase in drinking in the residence halls, or an increase in drinking of underage.
That's your whack-a-mole. That's your, yeah, but then if you literally, we go back to this, I mean, when we came up with that focus, as a group of 6 were struggling with what's at the core, that's what we came up with: health enhancing environment and promoting that environment. So the policies and environment as a whole, is those structures and strictures and so forth are what we're promoting. How else do we promote that environment, the positive, the health seeking, the affirming for those in recovery, the affirming for those who choose not to drink or drug, whether it's on an occasion or as a lifestyle, for those who are underage, or some substance that's illegal. So promoting if you will, the other activities, the old mantra, there's nothing else to do here. So can you speak to that a little bit as part of some of your experience?
I think that, we see that in a lot of ways in which policy affects change. We see that for tobacco policy. We need to have good cessation services in place. Same with cessating marijuana or cannabis. We need to help that student replace the behavior. But also at the same time, students often, the water kind of runs where it needs to make a path, right? And students' behavior is the same way. So if we're not giving students something else to do, if we're not giving students alternative options, if we're not suggesting to them in our education that they could replace that behavior with something else, we truly don't, we kind of just back ourselves into a corner. That's where I hear often, this didn't work. That doesn't mean that it didn't work. And I echo Jim's point about evaluation. We will find out why it didn't work through the evaluation process, but it likely was because we didn't see the full entirety of the way this policy competency, I think, honestly, is a very all-encompassing when we think about, it probably touches most of the competencies more than any other competency we have.
Yeah, very good. Thank you. Jim, some thoughts on this? Same question.
Yeah, well, I mean, Joan, I think did a great job of connecting a lot of dots, and I think that is important to think about policy in that type of way. For instance, when she mentioned the alternative programs, maybe the late night events, we at San Diego State University here, we have a program for the first 5 weeks where we try to take over their social environment from 10 p.m. till 2 a.m. And it's with large scale, like carnivals and things like that. But people may say, well, that's different. That's an intervention. Well, no, it was a policy that we will offer this. We set aside money. We have people who are assigned to do this. And so policy has a lot of implications. It is an important concept that you are institutionalizing something through your policy that you know will create an environment that will be more protective than if we just left people on their own. And so, and it can be popular. But a lot of times we think of policy as, well, these are the restrictions that should be in place that need to then be enforced. And those, of course, are also very important. And one of the things that the preventionists should be thinking about is, how do you describe the importance of these types of things? Because again, a lot of times the prevention is working with a team that may not fully understand the breadth of the types of programs that really should be done, and types of efforts. And so one of the things to keep in mind is that a lot of times we talk about, well, attitudes affect behavior. And so, you know, what can we do about attitudes? How do we get the knowledge and attitudes to change behavior? But the reality is, it often works the other way around as well. Behavior affects attitudes. And so when you put in place policies that change the behavior, you will start getting concurrent attitudes that support that. And that, of course, happened most dramatically, I think, with cigarette smoking. When policies said you may not smoke indoors or in workplaces and things like that, dramatic reductions in smoking occurred following that, and that was partly because people really understood the harms in a different way, that these are worthy of enforcing policy, so that will that ends up changing the attitudes. Now, if you walked around and did an attitude survey, you'd see much less support of smoking than when those policies went in place. Same type of thing with child safety seats, that had to have policies, had to have enforcement to get people to use child safety seats. Now it's ingrained. It's like that's what it means to be a caring parent, is that you've got, you know, for many people. And so it's this idea that sometimes policy will push, and policy can also help inform the norms. So it could be that either the alcohol sales at a stadium, or the allowing the tailgating to be at certain levels, or even the products that are in the campus bookstore can help clue even prospective students on what the norm is around drinking. And that's important to notice. And the preventionists should be looking for those eyes. How are we setting up an environment that's actually teaching the norm, or implying the norm, or implying the attitudes that we want to see, and shaping it in that direction, changing the behavior through policy to reinforce healthier norms and attitudes.
Yeah, you know, when you talked about smoking, again, decades ago, when a lot of the policy shift was happening, I knew a lot of smokers who said they wanted to quit. And then when a policy said you can't smoke in this work site, for them it became an anchor to do what they intended to do. Does that seem to make sense for some of what we're saying here for our campuses and our environment? Because saying it differently, many young adults feel peer pressure to drink or to do some other substances that would not be appropriate to use, not legal to use, but they don't feel the permission to do what they want to do in their hearts. Does that fit into this?
I mean, it can. I mean, there's lots of layers to this, right? So so it could be that that there is misunderstanding of what the norm truly is, and people may feel constrained to do what they think others want to do. And if you can set up a policy that makes it more free to avoid use, yeah, you could. Some of this is really location and timing specific, and
Yeah.
so this is also gets back into understanding your community and where people are doing the behaviors that you might want to see modified. So there's a lot of proximal decisions. The environment can help cue healthier types of decisions around the behavior or the unhealthier types. And so thinking about this holistically, what are the environments that they're in? What are the risks that it may be cueing or supporting? And what are the protective things that it could be cueing and supporting? Those can all be part of policy, all the part of creating an environment that's more likely to push people into making healthier decisions.
Perfect, perfect. So that's a great segue to our last big question, and Jim, I'll head this off with you. What specific messages do you have either about or to certain key audiences? You know, we have the traditional high risk folks. I mean, you talked about what it was the first 6 weeks or something at San Diego State. And so that's the first year students. We also have fraternity sorority that typically get involved in a higher risk, or student athletes. And there may be, again, on certain campuses, other higher risk groups. What messages about any of those groups or to any key audiences, decision makers on campus, those who hold the budget strings, faculty, staff, alumni, and any key audiences or messages you want to talk about related to policy and environmental strategies?
I think probably the preventionist, the expert who's trying to do this work should keep in their mind that there's a misunderstanding of the norms, not just amongst students, but amongst the policymakers as well. And so you might hear as you're talking up the chain that no, this will be very unpopular. This is not something that will get supported if you try to make a change. And I would challenge those of us who are trying to do this to try your best to get the data beforehand, but if not afterwards. Is it true that this is an unpopular idea? In fact, a lot of times we have the same misperception of norms, and so do our administrators, than this reality. A lot of students would love to see quieter dorms, do not want to have vomit in the bathrooms. There's a lot of support for policies that would make the environment healthier for students, and so I would think about, be very strategic, understand what it is you'd like to see change, find how that could happen, but maybe do some of that homework of is this something, where are the pushbacks going to come from, and are they right about that, or is there a way that it can be worked in a way that is actually popular or not as earth-shattering as you sometimes hear if you talk about, well, tailgating.
Right.
These third rail types of discussions.
Yeah, good. Thank you. Joan, thoughts on that?
I think there are two pieces. I think that I've been really encouraging prevention professionals to just lean into the hard and know that this work is incredibly complex. We didn't get to this place because because some education wasn't done. We got to this place because there is a societal way in which drugs and alcohol are viewed. We got to this place because of some lack of education, the norms being and the expectancies being not aligned with what is actually going to happen on a college campus. Those are all very complex sociological issues. And so I think we need to know that, for similar to what Jim is saying, that we're going to be challenging some tradition. We're going to be challenging corporate systems of influence. We're going to be challenging idolized behavior. Some of the things that the stories that students hear and are told about higher education, the expectancy that something would be like what they see on TV, etc. And so there's power in the university writing those expectancies and sharing about what a health promoting environment or what the true experience of XYZ university or college is. And I think, to Jim's point, we're often scared of that. Administrators are scared of talking about that. They say that there won't be support for that issue. I agree. I think the data tells us that there is a lot of support for many issues related to alcohol and other drugs. But also at the same time, if we don't say anything, if we don't write those expectancies, if we don't write those norms, if we don't take an opportunity to educate students about what it means to be a student at this university and what it means to be a successful student at this college, etc., the only thing that's doing the talking is a lot of bad information about what it means to be a college student. It's what they hear from their uncle around the Thanksgiving table or what they have seen in the media. And so, and that also is a decision, a policy decision. Not all policy and environmental work is a policy and holding students accountable. It's also an administrative decision to talk about norms and talk about expectations on that campus pre-matriculation, to do pre-matriculation education, to bring it up during convocation when folks are coming into campus their first time, to talk about why we want people to make healthy decisions and how we're going to help them do that. That in and of itself, I think, is the most scary part of the work that leadership have to do. And so it tails into the leadership aspect of our competencies, but it is also probably some of the most powerful work that we'll do in environmental management.
Yes, it's as you said, it's a tall order. A tall order. And I think one of the things that we came up with, again, as an advisory group and a group of 6 is, we've blended our expertise, our different ways of looking at things, but we are also on others, our predecessors' shoulders too. And so, one of the things I'll highlight that we put in this resource is just for the policy and environmental strategy section, we have resources, as we do for each of the sections. So there's resources that one can go to, and there's national resources and so forth that are all in this free publication at preventioncompetencies.org. How about any closing comments? You both have done a great job in, if you will, unwrapping this and, if you will, changing some of what a traditional understanding of policy and environment might look like. But any closing comments for our viewing audience? Jim.
Go ahead.
Jim, jump.
Okay, I'll jump in. Well, I mean, I think we've touched on a lot, and so I'm not going to break new ground, because there's plenty to do with what's already been said. But I think it's really important for the campus professionals, both those who are charged with doing the prevention work, but also those who are supporting, to understand why it's much more beyond having a good program, having a good education program, having a good intervention program, having whatever it is. Then you're just kind of spinning your wheels, taking the people who are coming in and hoping for the best. These are complicated behaviors. They're happening in lots of different environments and settings. And within each of them, there's decisions, there's availability, there's access. And so the professionals need to have a much more expansive view, have that width of focus that does talk about policies, and thinking about even policies widely defined. So yes, a lot of times policies are about restriction, but our policies can also be about inclusion of types of programs, types of interventions that Joan mentioned even before matriculation. There's a very well-researched concept of sending out discussion guides for parents to have with their students around it, and the effect of that. That only happens when a campus says, well, our policy is we're going to send that out. And so thinking about it and knowing that what's happening in your office or in your department is a tiny fraction of the levers that you will need to be looking at to make a community-wide, a population-wide impact around AOD.
Very good. Thank you. That was very, very helpful. Joan, closing comments.
I think that one part of the competencies that we haven't necessarily talked about here is the third competency, which is the use of coalitions. And I often get asked a lot about, like, so we're going to do a strategic plan, and one of our goals is going to be to have a coalition. And in and of itself, coalitions are not an evidence-based strategy. Certainly working together, and there has been great evidence about the role of coalitions, but you don't see have a coalition period show up in things like the NIAAA College AIM or other best practices documents. But none of this work, and leaning back into my like Debbie Downer, like, this is hard, this is going to be very hard work, it's difficult to do. I think it is less difficult when we invest in building capacity with others. And Jim mentioned this earlier, finding out about what the barriers are for implementing a policy, finding out what that maybe more people would be okay with this strategy or this policy than we think they would, checking our norms. And we do that by having those individual relationships with folks on our campuses beyond our traditional, maybe 2 or 3 partners that we think of, like Res Life and campus law enforcement. But by thinking about asking our alumni offices, our business offices that help set policies for the campus, our orientation folks about what they're seeing, about what questions they're getting from students, about what they would be willing to do, what they see as the problematic concerns on campus. Because it's through those relationships, whether you call it a coalition or building a capacity to create change, that are going to see that one person never sets policy. If one person sets policy, it's going to fall apart. But when a campus sets a priority, and that priority is carrying through, again, a policy or an implementation plan that changes the community, then that is really a collective impact or a collective effort. So I just think it's really important that third competency be noted, that we can't do this alone. We must do this together in a concerted effort.
Yeah, that's so important. Working together, working with the others so that you don't have silos on the campus, I think is part of your message. You know, 3 C's come to mind as just in wrapping up what I've heard you say. Conversational, having the conversation. So part of that goes, Jim, to, you know, knowing the audiences and knowing some of their needs and their aspirations. So the conversation, thinking comprehensive. So it's thinking about the unintended consequences and what you want, and thinking, if you will, coalition. So conversation, comprehensive, coalition. We can probably think of some others, capacity, but this is what we're in this whole document, this whole guide, and our whole thinking was aspirational. So this is like the ideal, thinking about those 8, and then with particular policy and environmental strategies. That's what it can take to help make a difference. So with that, I'm going to close and thank both of you, Joan and Jim, for your insights, for unpacking this, for helping to take some of the sting out of policy and environmental strategies, and demonstrating, you know, how important all of this is in affecting the change, another C, for our campuses. I also thank the Mid-America PTTC for their initial funding for this project. I thank Rich Lucy and his colleagues at the Drug Enforcement Administration for all of their good work, their continued good work, and their leadership and for their support of this webinar series. And then I thank the viewing audience for listening to this and hopefully getting inspired by this, and then actually going out and making that difference that is so important for the future of our college students while they are on our campus, and then for their lives as productive citizens for our culture. So thank you all. Thank you very much.